Good afternoon to all of you. Thank you for inviting me to this awesome event, Science Speaks, in celebration of PHARMAWEEK. Allow me to introduce myself briefly. I am Genevieve Caballa, an inclusive education and development consultant, pediatric physiotherapist, and the executive director of ALRES Philippines, a private nonprofit alternative school and therapy center for children of all abilities. I am here today to share with you some information on the issue of accessibility to healthcare for the deaf and hopefully inspire you to share in this special advocacy. At least 8 profoundly deaf babies are born every day in the Philippines, or that's one deaf baby born every 3 hours. That's according to Dr. Charlotte Chong, who's the director of the Newborn Hearing Screening Reference Center in UP Manila. A child who is deaf has so much potential, especially if his disability or risk for disability is detected early. That is why early detection and intervention are very important. The learning outcomes for the deaf improve with timely intervention. As they get older, they encounter many barriers to participation and productivity, largely because of the lack of awareness regarding their potentials and their difficulty in accessing both educational and healthcare services. At the end of this webinar, the participants would hopefully be more familiar with the issues of deaf individuals in accessing healthcare services and the need for disability sensitivity, be able to discuss initiatives being undertaken to move towards greater accessibility for the deaf in exercising their right to quality healthcare. And lastly, be able to reflect on practical ways for healthcare professionals to advocate for the deaf and promote equality in accessing healthcare services. This is a first step in being part of the solution to the marginalization of deaf persons. By being more aware of the issues of the deaf, we can influence the way society views their innate potentials and have a greater appreciation of their challenges, as well as how each one of us can support them within our own spheres of influence. This is Cha. You met her in the previous video. We were supposed to do this lecture together last year before the onset of the pandemic. Now that the format has been changed, I would still be referring to her and her experiences as someone who has dealt with accessibility and disability awareness issues or the lack thereof, firsthand. She is the star of this event, and her story is one that we can all learn from. Cha is first and foremost a loving mother to her son, Matt. She's an advocate for deaf women. We just celebrated International Women's Month, and she's one tough mama who also represents many other deaf women in different challenging circumstances. She is a graphic artist, having graduated from the College of Fine Arts in UP Diliman. She was also by the way, our salutatorian in the Miriam College Southeast Asian Institute of the Deaf when she graduated from high school. She is our ALRES Cafe manager. And in these pandemic times, she has also turned into entrepreneur. Visit her IG account at Silent Baker Charina. Her burnt Basque cheesecake is to die for. Now, she recounted growing up with a hearing disability wasn't that much of a hindrance to me because it was all I've ever known. I didn't know what it was like to hear. I didn't learn how to speak. because nobody could ever teach me how. So signing was the only form of conversation I know. She was the only deaf person in her family. The only barrier I see that I have with the normal hearing people is how to communicate with them. Sign language is a beautiful form of communication that needs to be taught to everybody. It truly is a beautiful and rich language. I believe that every healthcare professional should at least know basic, sign language. You'll never know when it would come in handy and could even save a life. Cha shared with you about her experience in the delivery room, wherein she was attended to by a resident doctor who knew how to sign. That made her ordeal giving birth much more bearable, even in the absence of her attending OB. In our center, Cha has given sign language workshops to the rest of the team, composed of pediatric physical therapists, occupational therapists, speech therapists, special educators, and also to our administrative personnel. This has helped us not only to communicate with her, but also to serve deaf kids when we go on therapy missions in underserved communities where there are no interpreters. She has also educated all the other members of our school community, the parents, and also the kids who learned how to sign to be able to order from the store and the cafe. She also served as assistant teacher, like in this inclusive arts workshop, wherein she helped our students with special needs express themselves through painting. She has been such a blessing to us all and is very much loved and appreciated. She has been through so much. Okay. Now, for the deaf, access to healthcare has been an upward battle. It affects the health of the deaf, but remember, it is a basic human right. Now, even in high-income countries, access to healthcare is still a challenge, but more so with a developing country like ours. Remember that access to healthcare is a basic human right. I repeat, a basic human right, and it is not a privilege for the chosen few. However, most people are indifferent to the plight of the deaf in accessing healthcare. They are left to deal with inequalities in the system on their own. Very few healthcare personnel actually know how to sign. Imagine going to a hospital for an emergency and not being able to communicate with the doctor what you're feeling and what you need. Or going to a pharmacy and not being able to ask what medicine would best relieve whatever discomfort and pain you have. There's also the use of inappropriate or politically incorrect terminology, like the term hearing impaired. Many deaf persons would argue that they are not impaired. It just so happens that they are the minority, but have a language that they can call their own as part of deaf culture. So here is a poll done in the Filipino Sign Language Law FP page. In the poll, more than 90% of the deaf who responded prefer a sign language interpreter versus the limited signing skills of hospital staff. So they would really prefer having an interpreter on board. Why? They said because it is less tiring, especially when you are already sick or there's some discomfort you're feeling. That's why you were rushed to the hospital. Then it's tiring to um, try to sign to someone who actually doesn't know how to sign or has limited signing skills. It is less frustrating. There's less miscommunication, especially with the exchange of information that's crucial to the treatment that would be given. And lastly, because of course the person is sick and would rather um, not be inconvenienced by the miscommunication that could arise from not being able to communicate with the healthcare professional well enough. Now, but although the preference for the provision of sign language interpreters is there among the deaf, in their absence, we know that there are very few sign language interpreters. The next best option is really for all healthcare workers to be trained at least in basic sign language. A couple of years ago, the Filipino Sign Language Law was passed. This is a milestone for the deaf community. This law mandates government agencies to train frontline healthcare workers in FSL. However, there are still some inconsistencies with the training content. Dr. Lisa Martinez, a distinguished linguist who has been at the forefront of policy advocacy for the deaf, along with some FSL specialists, have questioned the contents of the FSL training module. Now, learning FSL is not just about learning a language. It is about entering a world of experience, typically full of frustration and oppression. In that sense, teaching FSL must remain true to all the socio-political dimensions of the language, even for beginning learners. Okay? That is from Dr. Lisa Martinez, founder and director of the Philippine Deaf Resource Center. So they feel very strongly about FSL. The deaf pride themselves in having their own cultural identity. We always say, nothing for them without them. Our initiatives, though well-meaning, may sometimes not be able to address what exactly they need given if they are not given the choice to decide and be represented. In all efforts for the deaf, they should be represented not just as beneficiaries, but as decision makers and effective and active, okay, active collaborators. So 2 years ago, Republic Act 11106 was passed. In this law, FSL was now recognized as the national sign language of the Filipino deaf. Under Section 8, it states that Filipino Sign Language, okay, in the healthcare system, that state hospitals and all health facilities shall take steps to ensure access of the Filipino deaf to health services, including the free provision of FSL interpreters and accessible materials upon request of deaf patients or individuals or family members who are deaf. Take note that the free provision of FSL interpreters is now required by law for all government hospitals and facilities. So if by any chance you end up working for a public hospital, educate your colleagues and even your bosses about this law in case they are not aware that such a law exists. The law, however, is softer on private health facilities. It says there that private health facilities are encouraged to provide access to health services to all deaf patients and their family members. I hope, though, that if any one of you end up owning a clinic, a pharmacy, or even a hospital, you will also provide FSL interpreters and accessible materials to any deaf client you would serve in the future. Now that we are experiencing a pandemic, the deaf are faced with even more challenges and greater barriers to overcome. As part of the IATF safety protocols, we are all required to wear a mask. However, imagine how this has impacted the deaf, many of whom rely at least partially on lip reading to be able to understand what the hearing tried to communicate to them in the absence of sign. They miss out even more now that they cannot see the lips of people they are trying to communicate with. There are masks that have see-through mouth covers. These are also being used by our speech therapists for conducting their sessions. So at least this helps them, helps more of the messages to get through for the by the mouthpiece, because it is now more visible to the deaf. Another issue in accessing healthcare during this time would be the restrictions in bringing a companion in the emergency room or during an outpatient doctor's consultation. Without a companion who can interpret for the deaf patient, access to appropriate treatments may be compromised. So here are a few recommendations to improve access to healthcare for the deaf according to Kenberg, Fellinger, and Fellinger. Number one would be know their communication preferences. As I explained earlier, nothing for them without them. So ask in whatever way you can uh, what they would prefer, how they would prefer to communicate. For some, it's all right to just write down. Okay, write down the whatever has to be communicated, and it has worked. Like for Cha, as she has explained in the video, there was one doctor whom she consulted when she had her APE, her annual physical exam, who patiently wrote down uh, whatever she had to say, and they exchanged notes. And that actually worked for them. She appreciated that. Second would be provide access to sign language interpreters. This may be a challenge. This is actually a challenge for us because of the lack of interpreters. But it would be good to have a network. I think there's a network of Filipino Sign Language interpreters, okay, that you can tap, okay, mostly from CSB and also from UP Diliman. Okay, and I think the recommendation of the Philippine Deaf Resource Center would be to have hubs, okay, hubs in the different parts of the country, in Luzon, Visayas, and Mindanao, okay, wherein you can tap through information communication technologies a network of sign language interpreters. Third would be to maximize communication technology. It doesn't even have to be more advanced technology. So even SMS, even text messaging works. Like at times when some students or parents would like to communicate with Cha, but they don't know how to sign, or they're not comfortable trying to sign or gesturing, what they do is they text what they would like to ask her and then just show her the text message. Then Cha also responds by texting back. You can also send an email or even through FB Messenger, Viber, any other social media app. Lastly, to provide training on deaf culture for medical and paramedical staff, like what we are currently doing. So as a student, what now are some steps that you can take to be able to support deaf persons' access to healthcare? Okay, right here and right now. Now, Dr. Therese Bustos, the former Dean of the UP College of Education, shares some practical tips. This photo was taken during graduation rites last 2019, the first ever UP Diliman commencement program wherein sign language interpreting was provided. So this is a big step in our advocacy for inclusive education in the tertiary level. So here are some steps. First is to mingle with deaf adults. Observe how they sign. This is actually one of the best ways to learn. Diba? When you want to learn any language, immerse yourself in the culture of the people speaking that language. So in the same way, one of the best ways to learn how to sign quickly would be to mingle with deaf adults and observe how they sign. That is the most authentic way of learning their language. Second is to learn FSL through deaf teachers. Learn to sign the deaf way. When I first learned how to sign, although that time I learned American Sign Language, ASL, I learned through a deaf teacher. And it was so interesting because she was so animated, so excited always to teach us how to sign. So, and it's actually, uh, they say it's different from really learning from a hearing person because the deaf really communicate very visually. And um, as a student, and you're really trying to learn their language, it's the best way to learn from them. Third recommendation is try not signing and speaking at the same time. Try to deliver the message visually, which is what sign language is all about. Because sometimes deaf, let's say hearing teachers, they or those who are trying to learn sign language, they try to sign and speak at the same time. It gives them an illusion that they actually are being understood by the deaf person they're communicating with because they're also speaking while signing. There was a research done, and they showed some deaf persons, uh, teachers, hearing teachers who were signing and speaking at the same time. And then the deaf actually commented that they didn't understand much of what was being signed. So it just shows that it would really be better to not sign and speak at the same time. So you would really be able to communicate yourself to the deaf as visually as possible. You can also attend webinars like this webinar hosted by the College of St. Benilde School of Deaf Education and Applied Studies that I recently attended. It was a fun and interesting webinar with Raymond Manding, a representative to the World Federation for the Deaf, as facilitator. It is great to learn from the deaf themselves and discover their unique culture and language. During that webinar, they also shared with us an app that they are working on. It's called Fsl Buddy. You could actually download it for free on your phones, and it's really very helpful as a companion for you. If let's say you still don't know how to sign, you can just refer to the FSL Buddy. There are a list of words divided by categories. If you click those words, there would be a video, okay, being shown of how to sign those words in FSL. So do download this very helpful app. You might be thinking, I have so much to do already, so many things to learn and study for, especially now that learning is online. There's just so much workload in school, may it be academic or extracurricular, okay, with the orgs that you are part of. How can I even go into learning sign language and advocating for deaf accessibility to healthcare? Remember that it doesn't even have to be now. It can be an ongoing process of learning and discovery. Just take every opportunity to move things forward. In the end, if you have the opportunity to make things easier for the deaf as a healthcare professional, then just try to be as understanding, patient, sincere, and kind as you can possibly be. I am also a healthcare worker myself, and at times, when I really don't know what to do and how to help, I just resort to kindness, which is a universal language understood by all. So thank you for attending this webinar. Congratulations to the UST Faculty of Pharmacy Student Council on your 150th anniversary. And I wish you all the best in your efforts to provide universal health care with this first step towards making quality healthcare accessible for the deaf. It has been a pleasure giving this webinar for PharmaWeek 2021. Good afternoon.